My name is Marco Bonabello, and I will facilitate today's policy debate organized under the auspices of the OSCE PA General Committee on Economic Affairs, Science, Technology, and Environment, and with the scientific support of the Italian Society for Environmental Medicine, Allow me just a couple of technical announcements before we officially start. Please note that this meeting is being recorded and broadcasted live on the OSCE social media platforms and website. So you might also direct interested people to follow us online. Simultaneous interpretation into English, French, and Russian language are provided through the Zoom platform. You can choose your language of interpretation at the bottom of your Zoom screen. Requests to take the floor must be written in the chat, specifying your name, organization, and the language of your intervention. I will then give you the floor during the debate, meaning after the guest speaker's presentation. To ensure a smooth experience, I kindly ask all participants to mute their microphones when not speaking. Likewise, of course, please unmute your microphone only when given the floor. Please speak clearly and slowly to facilitate the work of our dear interpreters. I kindly ask all speakers from the floor to limit their intervention to 3 minutes during the debate so that we could have a good exchange of ideas and a timely conclusion of our meeting. So the agenda for today looks as follows. In a moment, I will pass the floor to our Secretary General, Roberto Montella, for some welcoming words, Roberto. And then immediately after to Ms. Doris Barnett, whom I see now connected. Welcome, Doris, and welcome, Elona as well, and Arthur, the bureau of our second committee. So the chair of the OSCE second committee for our introductory remarks. Afterwards, our guest speakers will deliver their keynote presentations. Subsequently, I will open the debate among interested participants. And depending on the time available, we should have around 45 minutes for the debate. After all interventions from the floor, I will ask our keynote speakers to answer any pertinent questions and share their final thoughts with us, if they have any. And finally, I will ask our rapporteur of the second committee, Ms. Elona Hoxha, to deliver her concluding remarks at the end of the session. We will close the meeting at 1700 sharp, 1700, of course, Central European time. Without further delay, I will now pass the floor to our Secretary General, Mr. Roberto Montella, for his welcoming words. Dear Roberto, the floor is yours.
Thank you very much, Marco, and welcome everyone. 72 people connected today. I think this COVID period has put us in a situation where we at least meet 2 or 3 times a week and on different subject matters. So I commend everybody for taking the time also to participate to this very important event. And congratulations to the leadership of the second committee for organizing this event. I'd like to welcome Dr. Neira, Ms. Manfredi, Professor Leved, Professor Ionidis, and Professor Piscitelli for their participation to this event. A year ago, when COVID exploded, we thought, how could we remain relevant in a parliamentary assembly that normally does its proceedings by meeting and by being in person. We have launched a set of parliamentary web dialogues. This is one of them, which has allowed us actually to interact much more often than we do when we actually meet in person. So I'm very pleased that this event is taking place under the auspices of the second committee, which has been extremely active. And this event allows us also to look at the links between COVID-19 transmission and fatality rates and air pollution. Environmental protection at the very center of our security agenda allows the OSCE to put itself at the forefront of one of the most urgent global and threatening security challenges of our times. We are looking at environmental degradation, climate change, pollution, and public health. Parliamentarians, of course, have a big responsibility in shaping the world, in deciding legislation, in setting up priorities and strategies. But of course, not all parliamentarians are expert on very specific issues. And that's why it's very good for us also to interact with other expertise from different parts of the scientific world. And in this particular instance, we are working together with the UN, the World Health Organization, the European Union, and the scientific community. I'd like to thank also the Italian Society of Environmental Medicine for helping us better frame these complex issues and supporting the organization of this timely parliamentary dialogue. As the pandemic has taught us, there is a link between environmental security and public health, meaning that the health of all the OSCE citizens is something that requires our full attention and commitment. And only such a connection has been duly explored and understood. We can aim for targeted policy proposals to bring the attention of the 57 participating states of the OSCE. So the OSCE will do its utmost to facilitate the exchange of good practices and lessons learned in this field. Before concluding, I'd like to say that this issue of climate change and also the link that we are trying to make today with health is something that struck also the attention of UN Secretary General Gutierrez at one of the recent Davos meeting, where he said that he has no doubt about the capacity of our planet to survive climate change. The planet will survive and somehow will modify. The question is whether our human species will be able to survive and live under the new changed planet. So it is our responsibility, of course, to make it more livable for us to continue to live on this planet. With those words, I leave it to you, Marco, and congratulations to everyone for participating in this event. 80 people now. Thank you very much.
And hopefully growing, I hope. Thank you very much, Roberto, for your steadfast support and words of appreciation for the work conducted by the Second Committee during the last 18 months. I would now like to invite Ms. Doris Barnett, Chairperson of the OSCPA General Committee on Economic Affairs, Science, Technology and Environment, to deliver her introductory remarks. Dear Doris, the floor is yours.
Well, thank you, dear Marco. Thank you, dear Secretary General Roberto. Dear colleagues, and especially dear guests, I'm so pleased to see you all, 80 and still growing participants to our meeting today and to our web dialogue. I would also like to welcome you on behalf of our president, Lord Peter Bowness, who unfortunately could not join us today due to urgent parliamentary work. He asked me to convey to you his support for this timely gathering. A special welcome and big thanks to our distinguished speakers for taking the time to contribute with their expertise to our security dialogue. A key topic that the health crisis has brought back on our agenda is precisely the focus of today's event. The pandemic has triggered greater awareness of the fragility of the environment and its importance of human well-being. As you said, actually, Roberto, the planet will survive, but will we? Last year, against the backdrop of increasing SARS-CoV-2 infection rates throughout the OSCE region, the Bureau of the General Committee on Economic Affairs, Science, Technology, and Environment started exploring possible correlations between COVID-19 transmissions and fatality rates and air pollution. In this regard, we were captured by the innovative work of several research institutes, including the Harvard T.H. Chan School of Public Health, the Max Planck Institute for Chemistry, and the Italian Society of Environmental Medicine. Inter alia, they found that at least 15% of worldwide COVID-19 deaths can be traced back to long-term exposure to particulate matter, PM, thus confirming that atmospheric PM should be regarded as a contributing factor to COVID-19 infections. This should not come as a surprise, though. We have been aware of the determinant effects of environmental degradation and particularly of air pollution on citizens' health for quite some time. What I found surprising instead is the relatively low perception of this problem throughout the OSCE region, despite very scarce numbers. For instance, the World Health Organization data indicates that 9 out of 10 individual breath air containing levels of pollutant able to increase the risk of heart attacks, strokes, lung disease, or cancer, and premature death. The European Environmental Agency latest official data show that almost all Europeans still suffer from air pollution, leading to more than 400,000 premature deaths across the continent. Finally, recent evidence show that exposure to PM from fossil fuel emission alone accounted for 18% of total global deaths, almost 1 in 5 in 2018. These alarming statistics underscore how environmental degradation, on the one hand, represents a major global threat to the well-being of our civilization, and on the other, is profoundly impact socioeconomic dynamics in our societies. For instance, consider the number of the so-called environmental refugees we might face soon, or what else could be accomplished with a huge amount of money we regularly spend to cure our sick people, or to mitigate and adapt to the looming climate crisis. Notably, changes in air pollution levels have immediate positive effects on the climate too. In fact, by addressing pollution, we also address an easy to implement solution to climate change. These are synergies that we need to understand better and build upon in our policy making work. When we indicated these exchanges with our scientific community last year, we thought it would be useful to expand this debate to the entire assembly, so that each one of us may contribute and influence relevant policies back home. So here we are, dear colleagues. The ongoing crisis has shown that the protection of the environment, including our precious climate, is the critical precondition to ensure the well-being of both the planet and of the people we represent, not to speak about animals or plants. Now, more than ever, we need timely and well-calibrated environmental protection policies to innovative development approaches based on the latest scientific evidence and international standards. Only by doing so, we can safeguard public health, reverse climate change, promote socioeconomic development, and enhance global security in our region. In this context, the 2021 European Commission's Action Plan towards zero pollution ambition for air, water, and soil, building a healthier planet for healthier people, represents a step in the right direction. There is much to discuss, dear colleagues. I now look forward to hearing from you how we can better safeguard our health, our environment, and our future. Thank you for listening.
Thank you very much, Doris, for your active engagement, leadership, and inspiring words, and also for placing, I think, the PA at the forefront on this agenda issue. Thank you very much. I will now. I'm quite thrilled to introduce a very impressive panel of guest speakers. So we're moving to the next agenda item, whose contributions to our debate, I'm confident, will be invaluable. So our first speaker for today is Dr. Marianera, the Director of Public Health, Environment, and Social Determinants of the Health Department at the World Health Organization. Dr. Nera has been working for the WHO since 1993. Between 2002 and 2005, Dr. Nera was also Vice Minister of Health and Consumer Affairs in Spain and President of the Spanish Food and Safety Nutrition Agency. Before joining the WHO, she obtained extensive field experience working in Africa as a public health advisor in the Ministry of Health of Mozambique and in Rwanda, where she served as public health advisor for UNODP. Dr. Neira, thank you very much for accepting our invitation. Despite a very busy agenda, I can imagine. I look forward to hearing now your insights on the impact of environmental degradation and pollution on public health and security, including in connection with the climate crisis. The floor is yours, dear Nere.
Thank you very much. And it's really a pleasure to be with you today, and particularly talking about a topic that no doubt is of interest of anyone in the planet today. The moment we are talking, we are celebrating here in Geneva the World Health Assembly. So we have the virtual presence of 194 ministers of health. Of course, they are discussing about the pandemic and the vaccines and the next challenge in terms of public health. But obviously, we need to, as well as the health community, try to contribute with solutions. And that's why I'm so excited to be part of this panel today. Since you are giving me 6 minutes, I have 6 messages for you, and even a little bit provocative, if you allow me. The first message is a number, is 25%. 25% of the global burden of diseases means of the causes of death. I mean, why we are dying, 25% of that is related to exposure to environmental risk factors. And environmental risk factors that are not a disaster or something that we cannot avoid. No. Environmental risk factors that we can modify. So this is the first message I would like to share with you. We know since a long time that there is a very strong linkage between environment and health of the people. So my first message is this terrible number that can be changed, and it's a question of security, not only for the health of the people, but for our economy, for our society, and for the rest of our survival. Second message. At the moment, we are fighters. Of course, we need to fight the pandemic. I think the world has developed an incredible capacity to fight, to have the best firefighters, and try to come down with the pandemic. But we need to be fighters, but we need to be strategic thinkers. And to be strategic thinkers as well, or strategic planners, we need to again go back. Why are we here? And we know that we are here because we have been deforesting, we have been not respecting the biodiversity, we have been playing with this very fragile barrier between human health and animal health. And the result of all of that, we have been populating in a very dense way our cities, our urban environments. We have been commercializing and trading with animals, wild animals. We have been really essentially polluting everything that we were touching, everything from the air we breathe to the water we drink to the food we eat. So this has to stop. So this is my second message: stop polluting whatever we touch. Of course, the planet will survive. It's very arrogant when we say we need to save the planet. The planet will save themselves. It's ourselves that we need to save. My third message is let's start to build the security we need. Those first 2 messages were a little bit negative. Let's now focus on what do we need to do to reinforce our security. The world is very insecure again with the climate crisis, the climate change crisis. But we need to now make sure that we will put some green walls, we need to put some protection and make sure that we reinforce our security. How do we do it? Third message. Stop giving subsidies to fossil fuels. Please, you have influence, you are parliamentarians, you can modify and influence the thinking of your taxpayers. Stop financing something that will be negative for your lungs. Think about your health. Don't even consider other things if you don't want at this stage, but stop giving subsidies to fossil fuels. The fossils needs to go back to the fossil place where they never should left before. The fourth message is about create an awareness campaign to make sure that the citizens will be the first one to demand and to put pressure on our policymakers, on our head of states, on our politicians to make sure that they realize the connection between health, environment, climate change, pollution, good economic benefits, the recovery of our economy and the recovery of our society. All of this is connected. We have tons of evidence. We don't have time now to present it, but ask it for it, you will get it. We have tons of evidence on everything, the health benefits that can be obtained and the economic benefits that can be obtained if you choose the right source of energy, the right source of the whole your cities will be designed from an urban point of view, and the right commuting modalities for your cities, and the way you will produce your food on a more sustainable way. So create this very strong campaign for citizens to realize that if they care about their lungs, they should care about climate change. And this is something that we need to pass that message. This is not in favor of the environment. This is in favor of our health. So it's a question of survival here. We are getting completely on a very difficult situation where it's about your health. And I will say, this is about your lungs. And I will put it on the COP26 main entrance, a big couple of lungs for people to understand that this is not an environmental negotiation. This is a public health, pure economic and society survival negotiation. The next message, and I don't know if I am on 4 or 5, doesn't matter, is the role that the health community can play. And that's why we are aligning all our troops, if you allow me to say that, and mobilizing the white coats to say it's enough. I mean, we don't want to keep treating asthma cases, treating lung cancer cases, treating ischemic heart disease and ictus, stroke. We want to tackle the causes of that. We know the causes. There will be an enormous benefit to tackle the causes of climate change. We will reduce air pollution, we will protect our health, and we will generate green jobs, we will generate a better economy, more sustainable one. People need to understand this connection, and for that, the parliamentarians' role is fundamental, otherwise we will be on a very insecure momentum. And my last message is that COP26 has to be a kind of stopping these numbers. I mean, COP26, 26 means that for 26 years, actually 27, because last year we didn't have it, 27 years we have been negotiating something that is obvious, is common sense, it makes a lot of economic benefits, and it will make a lot of protection, reduce our insecurity and our vulnerability, all there. So we will present the health argument for more climate action. And for that, the role of your parliamentarians, the OSCE parliamentarians and voice will be absolutely fundamental. If you can join us, this white coat army that will be presenting this very strong health argument. Thank you for your attention, and I hope that I didn't went through my allocated time. Thanks, over, Marco.
Thank you, Dr. Nera. You did actually incredibly well. Besides being a very eloquent and inspiring your words, you were also sticking really to the time schedule. So I take it that we need to save ourselves, but also that we have a lot of opportunities still to do that. So it's very good. Thank you for your contribution, and we hope to strengthen also our partnership with the WHO in the coming months, years. Our next speaker is Ms. Veronica Manfredi, as Director for Quality of Life in the Directorate General for Environment of the European Commission. She plays a key role in leading Europe towards a zero pollution ambition, thus contributing to tackling challenges related to the climate, to biodiversity, to circular economy, etc. Her directorate is responsible also for key EU policies on clean and well-managed water, clean air, control of industrial emissions, and prevention of industrial accidents. It would be very long to go through all your background. Ms. Manfredi, thanks again for accepting our invitation. And of course, congratulations on the recent adoption. I think it was on 12th of May by the European Commission of the Zero Pollution Action Plan. I'm curious to learn more about the measures envisioned in the plan, or anyway, to hear your views on how we can better protect the environment, safeguard public health, reverse climate change, and promote socioeconomic development. The floor is yours, Veronica.
Many thanks, Mr. Monabello, Chair Montella. Thank you for giving me the opportunity to be with all of you today. I'm really honored. It's actually the very first time that I speak to the Parliamentary Assembly of the OSCE, so it's really fantastic to be with you, also because already from your names, from your face, I see how much you represent the world that we are trying to address. as Marianera was speaking, I was reminding the very first time we met. It was February 2018, and being both of us passionate about public health problems, I think we both felt how much the public health debate was absent still or not sufficiently represented on the public arena, notwithstanding all what she has just said, and Mrs. Barnett before us has been saying that it makes a lot of economic sense to, go to the causes of problems rather than taking remedial action. And now I think it's almost difficult, actually, I would say it's impossible to open up a newspaper in any part of the world where you are without reading about COVID-19 and the public health crisis that it has created everywhere, stopping or at least dramatically impacting our economies. So we have reached a tip of an iceberg that eventually seems to have waken up a little bit. But, I think that deep down, we all ask ourselves, is really the COVID-19 the, let's say, biggest threat to the humanity, or are we just faced with a symptom of a much greater malaise? And there, of course, my analysis very much rejoins the one of Dr. Neira. And for that, I think it would be nice. I think the Secretariat has received a little PowerPoint presentation. Since I have 7 minutes, I will present to you 4 slides. And I think we can directly dive into slide number 1, if you don't mind. So the next one, please. Where essentially you will see, the next one, please. Thank you so much. You will see that if we take a step back from the headlines of the day, we can really figure that actually we are encountering right now 4 major intertwined ecological crises across the planet. It's about climate change, it's about biodiversity loss, it's about the completely unsustainable use of our natural resources, and it's about pollution. Now, clearly, this is so because our society has been really undergoing very, very accelerated phenomena of growth, urbanization, and this basically all over the countries that are represented during today's call. We have witnessed over the last 50 to 60 years a dramatically increased demand for safe food, drinking water, energy, healthcare, which are all, of course, very legitimate demands, but which also put additional pressure on our environment. So we are now in a situation of great stress, planetary stress, and to make matters worse, these looming systemic threats to the planetary health bring along a number of associated human and animal health risks in the form of infectious and non-communicable diseases, antimicrobial resistance, not to mention water scarcity and food safety problems. Now, unfortunately, and I would like to add, hopefully, unlike the immediate threat of the COVID-19, these global challenges will stay with us for generations, and there is no hope for a miracle vaccine that will make them go away. So I think that, if you don't mind me completely abusing medical metaphors, contrary to Dr. Marianera, I'm not a medical doctor by training, but I think that we need here a combination therapy. We need for this patient, which is the combination of the planet and ourselves, an approach to designing and implementing programs, policies, legislation, and research in a way that we pull together multiple sectors to communicate and to work in a much more homogeneous manner. And this is where we arrive to the slide that you have now in front of you, the Green Deal. The European Green Deal, which was adopted, as you know, in December 2019, just a few months before the COVID-19 outbreak. I mean, we would have never imagined how much this communication could have become, I would say, pivotal for the European Union at the time, although it was always a top political priority. Well, when we have adopted this Green Deal, we have put forward a set of initiatives that are all intertwined, interlinked with each other, very much like the ecological crisis that we are tackling. At the core of the Green Deal clearly is the climate neutrality goal of 2050. But the Green Deal is so much more, because it also recognizes the need to move towards a zero pollution ambition to protect the health of our citizens. It tackles tackles biodiversity, it tackles circularity, and it does so by trying to adjust the functioning of all the crucial economic sectors which are behind the sources of pressure. It's about sustainable farming, hence the Farm to Fork initiative. It's about a new way of producing, hence our industrial strategy. It's about the way in which we produce energy, hence all these strategies linked to clean and renewable energies. And of course, it's about our mobility, hence a very encompassing strategy on smart and sustainable mobility. These all accompanied by a just transition fund in the name of leaving no one behind. So we can move to the next slide, because all I wanted to stress is that, of course, whilst we recognize that we have this, I would say, moral, but also super urgent obligation to change, we wanted really to do that in a manner that enables us to go to the key action areas from which to start. What you see in this slide is actually the precise action areas that we have identified in the Zero Pollution Action Plan adopted by the College on the 12th of May. Essentially, we have identified as key areas, key thematic areas for action, all the actions that are linked to improving health and well-being, all those linked to enabling humanity to live within the planetary boundaries, and a number of very specific actions to drive the European Union towards enhanced zero pollution production and consumption. We have identified then 4 main enablers, which essentially have to deal with, first of all, I would stress, implementation and better enforcement of the acquis that we have. Only in the area of pollution prevention, the European Union has no less than 33 different pieces of legislation, without mentioning, linked in particular to the environmental acquis, without mentioning a number of other laws that of course regulate the way in which, for example, we produce energy, or those that apply to the agricultural sector. We have identified as another key enabler for change, the one of measuring for the first time in a totally integrated manner through the creation of the first ever zero pollution monitoring and outlook framework, how much the policies that we are putting in place under the Green Deal are really delivering reduction of pollution across air, rivers, seas, and soil. This is an exercise for which we have put together in particular the colleagues of the European Environment Agency, which are our I would say most knowledgeable repository of data about the actual state of the environment, and colleagues of the Joint Research Center, which have developed a very good expertise in forecasting the trends of where we are going if we well implement the policy and the legislation that we have put in place. And of course, these 2 main actors will not work alone, but really in close synergy with a number of other executive agencies, commission departments, and of course, academic experts that will feed us with the relevant data. We need to boost a change across society. And for this, I'm particularly pleased to have you today with me, because I think I will need all the actors internationally, nationally, regionally. It's not by a coincidence that we will essentially launch together with the Committee of the Regions in the European Union, the Action Plan for Zero Pollution and the related stakeholder platform, the colleagues of the WHO, which are so precious to us. We need to drive a change across multiple methods. Awareness raising campaigns, digital tools, education. We need to act on all the fronts. And finally, but in no way least, our agenda is in an agenda of promotion of change worldwide. We are doing that because we tend to export our regulatory standards also all the time, but at the same time, really, we need to change the rhythm at the path of these synergies that we can create between climate neutrality and zero pollution. So we can move to the next slide, indeed. Thank you so much for anticipating me. And this is the slide that shows to you the 9 integrated flagships that characterize the Zero Pollution Action Plan. As you can see, they translate what I've been telling you. So they move from reduction of health inequalities. Here we will be building on a cancer inequality registry, which has been launched by the European Commission when adopting Europe's Beating Cancer Action Plan, to expand this register of inequalities and diseases related to the inequalities which are inherent to the pollution framework towards other diseases than cancer alone, urban actions, zero pollution across regions, zero pollution choices, etc., etc. So as you can imagine, we will be not lacking work over the next months. And in particular, we're looking forward to a very strong cooperation with the colleagues that are working right now in the new European Bauhaus initiative. You know how much of the climate change and pollution problems stem also from buildings. So the European Union has been stressing a lot the importance to launch a building renovation wave, and work is ongoing also towards designing building styles that will at the same time reconcile our life with nature, facilitate the uptake, especially among poorer people, of more of cleaner, I would say, heating and cooling systems, and in general a better living standard for all. I would like to stop here. I hope I've also managed to stay within the time allocated to me, and look forward to the further debate with all of you. Thank you.
Thank you, dear Veronica, for this very insightful and interesting presentation. Clearly, from your advantage observation point, you can more easily connect the dots, which is what you've also shown us in this presentation, and hopefully coordinate a lot of joint efforts towards a zero pollution near, I would say, future, and the healthier planet for healthier people, using your slogan. So thank you very much for your time, and please stay with us so that we can then engage you again after the debate to see if there's any need to do that. I will now move to our next speaker, which is Professor Jos Lelyveld, is the director of the Atmospheric Chemistry Department at the Max Planck Institute for Chemistry in Mainz, Germany. With a PhD from the Faculty of Physics and Astronomy at Utrecht University, he is also affiliated to the Cyprus Institute in Nicosia. Further, he's associate editor of several scientific journals and active as a member of the German National Academy of Science, Leopoldina. He has published more than 450 peer-reviewed articles and received many international distinctions. His research addresses atmospheric chemistry, climate change, and planetary health. Dr. Lelyveld, I'm honored to have you with us, and we're keen to hear your views and insights on the adverse effects of environmental degradation and pollution on public health and security. The floor is yours.
Yes, thank you very much, and thank you very much also for the interest in this topic. And I'm going to share my screen, show a few slides, and move to this slide here. Climate change and environmental change, of course, has many impacts on health, and there's a number of exposure pathways is indicated here from a recent article by Sir Andy Haynes and colleagues. We have extreme weather events, heat stress, which is increasing. Think about North Africa, Middle East, next door to Europe, and air quality, water quality, and of course also water availability, food supply, vector-borne diseases, and social factors. And on request, I would like to focus on this topic here today, air quality. If we think about air quality and health, then we need to make a distinction between short-term effects and long-term effects. Short-term effects have been quite infamous since the London smoke. You may remember, maybe not personally, was in the 1950s, but when something like 10,000 people died in a single smoke event. Of course, these sorts of events are quite rare, but nevertheless, there is a lot of exacerbation of asthma. There is actually a lot of hospitalization involved with lung disease and even mortality. But the most important impact of air pollution on health is actually the chronic exposure, causing long-term effects, which leads to strokes, lung cancer, respiratory conditions, cardiovascular disease, and which reduces our life expectancy. And I'll give some numbers later. it was mentioned by Mrs. Barnett that there was a study by our institute together with the Harvard Chan School of Public Health, where we have also linked data that have been collected in the United States from the Medicare database, which is a huge database, and using this data to estimate what kind of influence air pollution would have on the severity of COVID-19. And actually, air pollution is a cofactor because it influences exactly the diseases that increase the severity of COVID-19. And we calculated that globally, about 15% of COVID-19 mortality can be attributed to air pollution. And you can see that in some regions, it's even more. And also in Europe, we see quite high numbers, especially in Eastern Europe. Of course, we cannot give you final numbers yet because this is still ongoing, but we will keep track on what's going and inform you if you are interested. But the fact that ambient air pollution and also household air pollution leads to pre-excess mortality has been known for a long time. And the most recent estimates for excess mortality range between something like 5 and even more than 10 million per year. It depends on, these numbers depend on pollution compounds like particulate matter that was mentioned earlier, but there's also ozone and nitrogen oxides. It also depends on the disease categories that are being addressed, and also it depends on exposure response functions, which are being retrieved from epidemiological cohort studies. And here again, you can see that in some areas with heavy pollution, like in Eastern Asia and Southern Asia, but again, also in Europe, we see quite high loss of life actually related to air pollution. Now, this map actually shows this is a combination of population density and also health effects on through air pollution. So, so for example, in the Sahara, you have a lot of dust, but not too many people. If we look at estimates of the Global Burden of Disease study, the most recent one, which was published in November last year, we see as a ranking as health risks leading to deaths in 2019. And this is a bit different for females than for males. So first, the image for females, we see high blood pressure is really the main public health threat. But to some degree, actually, this is also influenced by air pollution. And we see dietary risks and high fasting plasma glucose leading to diabetes, an indicator for diabetes. But you see air pollution here is the fourth leading global health risk. And if you look at it from males, we see that tobacco smoking is, of course, still the number one there, and also high blood pressure. But also here, well over 3.5 million men in 2019 died from the impact of health impact of air pollution. And if we translate this in terms of loss of life expectancy for different risk factors, we can compare. You see, for air pollution, we calculated globally the loss of life expectancy is almost 3 years. Now, not all of this is avoidable, especially desert dust, sand, etc. And there are some natural sources. Not all desert dust is actually natural, but anyway, this is not avoidable. About 2/3 of it actually is avoidable. And there you can see that the health risk of air pollution is very much comparable to that of tobacco smoking, with a global loss of life expectancy of more than 2 years. And if you compare that with parasitic and vector-borne diseases, mainly malaria, actually, we see that the number is much higher. And I thought that OSCE might be interested in comparing with all forms of violence. And here we're talking about, domestic violence up to international armed conflicts. And you see that there are only 5 countries in the world, or 5 or 6, where the loss of life expectancy from violence is larger than of air pollution. And if we take it on a global average, we see that air pollution has a loss of life expectancy that is almost 10 times larger than all forms of violence. So climate action and improving air quality, I only reiterate what previous speakers have said, have major health benefits. And of course, by reducing fossil fuels, you have co-benefits from climate action and improving air quality. And I really hope that, I think the world is now convinced that there is a problem here. The awareness of health impacts was not so large, and I hope that this discussion can help improve this awareness. And I'm a scientist, so I need to give you some references, but if you need more information, I'll be happy to provide it. Thank you very much.
Thank you very much, Dr. Oliveliv, for sharing your expertise and very interesting findings. I found your presentation very interesting and also simple to understand. Rest assured that we will treasure your presentation, and also look forward to recommendations which can inform our future policy efforts in this domain. Before I move to our next speaker, I would like just to remind all our participants and our members of parliaments to register for the debate. You can do that through the chat function, or of course you can also do that by contacting directly my colleagues Anya, Hannah, and myself. I would now like to move to our next speaker, Professor John Ioannidis. He's a professor of medicine, professor of epidemiology and of population health, and by courtesy also of statistics and of biomedical data science at Stanford University. He is the director of the Stanford Prevention Research Center and co-director of the Meta Research Innovation Center at Stanford. Professor Ioannidis is a physician scientist, writer, and professor who has made contribution to evidence-based medicine, epidemiology, and clinical research. He was editor-in-chief of the European Journal of Clinical Investigation from 2010 to 2019. Professor Ioannidis, we are very honored of your presence, and I know you had to wake up very early to be with us this morning in California. It speaks, I think, very clearly about your commitment and to the cause of public health and evidence-based policymaking in this field. So, Professor, the floor is yours. Thanks again.
Thank you for this very kind invitation. It's a great honor for me to join you today. And good morning from California. Let me see if I can share my slides. So much that you will hear from me today pretty much will echo what the previous speaker said. Clearly, we are facing a major crisis, a major emergency. I think that environmental degradation, environmental pollution is an emergency for the planet. It has major repercussions on public health, and it has major repercussions on the future of our planet and the future of our civilization at large. I think that there's no doubt about that. The science is very strong. We have evidence that has been accumulated from very different scientific disciplines in that regard. We are talking about a huge burden of fatalities every year. It is estimated that air pollution alone approximately is killing about 7 million people every year. This is an average from several studies, 4.2 million from outdoor air pollution alone. There's strong evidence for associations with increased stroke, with heart disease, with chronic obstructive pulmonary disease, with lung cancer, and with acute respiratory infections. There's also correlations with other conditions that we still need to probe a bit better, whether they're epiphenomena or causal. For example, there's a number of studies that have been emerging about mental health. And you can understand that all diseases, in a sense, communicate with each other, and they communicate with our experience as citizens and inhabitants of this planet and of the environment that we inhabit. There's other studies that actually suggest that the estimates of mortality burden are double these numbers, and maybe they're more correct. For example, this is one such study that estimated a global total of 10.2 million premature deaths annually attributable just to fossil fuel component of PM 2.5. And even with some adjustment for some improvements that have happened when these data were generated compared to now, mostly in China, still that would be 8.7 million premature deaths per year. So this is a tremendous burden of disease, a tremendous number of deaths, as Professor Lilleveld showed. These are people who die very often in young ages, and we have a tremendous loss of life. This is another map, like the slides that you saw earlier, that shows the contribution of fossil fuel consumption to surface PM2.5 around the globe, and also a map of excess deaths. And you can see visually that there is pretty much good tracking of these two features. Human health is affected in multiple ways when we have an alteration of our ecosystems. You can think of this as a cascade and an overlapping thread that affects multiple dimensions, and each of these dimensions eventually would contribute to negative health outcomes. We're talking about changes in land use and cover, including deforestation, dams, irrigation, agricultural extension, and intensification, livestock management, urbanization, road construction. Of course, you would say some of that we need. I mean, we need road construction, but there's different ways that one can achieve that, avoiding the environmental negative impact. There's issues of resource scarcity, land degradation, water scarcity, deforestation again, wildlife population declines. There's the major threat of climate change, with warming temperatures, with elevated carbon dioxide, with more extreme storms, hydrologic extremes, and sea level rise. And all of that leads to deterioration of our ecosystem services in terms of provision of nutrition, safe water, clean air, protection from natural hazards, regulation of infections, and of infectious disease propensity, and also eventually outbreaks and pandemics, and maintenance of a stable climate. You have the perfect storm. And unfortunately, we only know mostly about the linear effects of each one of these factors, but they have very strong interplay, they have very strong interdependence, and we cannot rule out the possibility of chaotic and catastrophic events that would arise when you have a combination of these factors that really reaches a critical point. And that would affect both human health, but also any other dimension of our existence as humans on the planet. Here's a pretty long link. Climate change, it's a top existential threat for humanity. But one would ask, does it affect armed conflict? Well, apparently it probably does, even though it seems like a long link. This is a paper published a couple of years ago in Nature. Top experts deliberated on the evidence. All of them thought that if one were to look for an estimated relationship between climate and conflict risk to date, or at least for what happened in the past, they all suggested that there was some effect, and a number of the armed conflicts of the past could have been explained through climate considerations. And when someone is looking at what are other factors that are leading to armed conflict, of course, there's uncertainty about the exact impact of climate variability. But when you look at substantial changes, for example, in temperature, there's less uncertainty and more propensity to say that this is likely to lead to substantially higher conflicts. You have then all of these other factors, including low socioeconomic development, low state capability, intergroup inequality, recent conflicts in neighboring areas, external interventions, economic shocks, natural resource dependency, population pressure, political shocks, illiberal democracy, mistrust of government, and corruption. Most of them depend on each other. Most of them feed on each other. And most of them are also strengthened when you have an environment that is failing, that is being degraded. COVID-19 may eventually be an instigator of armed conflict and unrest and destruction for humanity. COVID-19 provides very little opportunities for health and cooperation. It stresses systems, it stresses societies, it creates new armies of unemployed, of poor, of disadvantaged people in environments that are already degraded. And of course, we cannot tell whether that would lead to a major crisis, but we have to be very, very careful that an armed conflict might be one of the consequences of these devastations. Eventually, we need to think big. We need to think about all the dimensions of public health that are affected by environmental degradation and by climate change. We need to think of medical and physical health. We need to think of mental health. We have seen that in the COVID-19 crisis. We've seen a tremendous toll on mental health with stress, anxiety, depression, grief, sense of loss, strains on social relationships, substance abuse, and post-traumatic stress disorder. Each one of these factors can cause all that package of devastation on our health. And of course, community health, health writ H large, with increased interpersonal aggression, increased violence and crime, increased social instability, and decreased community cohesion. I will end just with a quote from WHO. 24 and 23% of global disease cases and deaths, respectively, may be due to degradation of environmental elements and the public health damage that this degradation may cause. So clearly we have cause for concern, and I think that you're in the best position to act urgently, to act now. Thank you.
Thank you very much. Thank you very much, Professor Ioannidis, for this punctual and I think very inspiring presentation. I think it clearly showed us some of the challenges that our population is facing, but also underline, I think, the key role that science plays to inform policymaking in this field. There's a lot of different areas of interconnected research that needs to be explored and understood. Having said that, I will now move to our, and also thank you for sticking all to the time frames. You've been very, very diligent. Our last speaker is Dr. Prisco Piscitelli. He's the Vice President of the Italian Society of Environmental Medicine, whose scientific support and advice were instrumental for today's event in putting it together, but also a bit for building our knowledge in this field over the last few months. Dr. Piscitelli holds a PhD in biology and biotechnology and is an epidemiological doctor by vocation. He is also a specialist in hygiene and preventive medicine. Caro Prisco, I look forward to hearing now your insights on the adverse health effects of environmental degradation and pollution, as well as CIMA's critical contribution in this regard over the last months, years. Dear Prisco, the floor is yours.
Thanks a lot, Marco, and thanks to everybody. CIMA is really honored and glad to cooperate with OSCE in understanding evidence about the links between pollution and citizen health and security. Please, I'd like to have my presentation, if possible, on the screen. And starting from the second slide, we can say that the topic of air pollution and health is a very recent topic. Only in 2015, it was addressed by the General Assembly of the World Health Organization, which is currently in these same days taking place, as Donera has told us. And please, next slide. The International Agency on Cancer Research had already recognized fine dust, so PM2.5, PM10, as a certain carcinogenic substance for human beings. So this is very important. And we must be aware that 81% of the EU population is currently exposed to levels of fine dust by PM2.5, which are higher than those recommended by WHO in 2005 guidelines on air quality. So there is the need to revise also our limit of exposures. Next slide, please. Thanks, next slide. So how CIMA has emerged globally in 2020 and started to cooperate with OSCE, mainly tackling this link between air pollution and the pandemic, the COVID-19 pandemic, in a perspective on One Health approach. Actually, we started in observing that the higher number of deaths that we were registering in Italy due to COVID-19 were occurring in northern Italy, which is known to be one of the most polluted areas in Europe. And so we started making research on that. And please, next slide. Incredibly, we had also the opportunity to find for the first time a first evidence about the presence of the SARS-CoV-2 RNA, so the genome of the coronavirus, on the particulate matter of Bergamo, the city of northern Italy that was really the hotspot of the first wave in Europe for COVID-19 infection. Of course, this cannot prove that there was an infectivity power, but we proposed to use also this kind of detection as a tool to have a higher alarm on this topic and to prevent future waves. Next slide, please. And as you see, the virus is, of course, so small that can be also attached to particulate matter. Next slide, please. And so it can flow via airborne dust, even more farther and longer than the 2 meters or 3 meters, up to 8 meters, if it is close and attached to particulate matter, which when the particulate matter is very high, there are very high concentration of PM2.5 or PM10 in presence of the right condition of humidity and temperature that are very specific, for example, in Padana Plain in northern Italy. Next slide, please. So you see how the droplet transmission can be enhanced by the airborne transmission. Next slide, please. And that the number of droplets emitted during a simple cough is enough to create possible risk for infection, either for longer distance than 2 meters, during several seconds. Next slide, please. So the other topic that we started to investigate is the topic of indoor environment. Indoor environment represent even a more crucial condition of risk for becoming infected by COVID-19 and should be addressed to protect the security of European citizens during this new phase of reopening after the last wave of COVID-19. Next slide, please. We can move. As we are recovering new contacts and social lives that expose ourselves to the possibility of breathing potentially infected droplets in indoor environments. Next slide. So CIMA has developed a protocol for indoor air quality and COVID-19 risk, and is actually our frontier research in this moment. The model that CIMA has developed simply uses CO2 as a key indicator of room crowding. This means that if a room is crowded and there are too many people in an indoor environment compared to the space available and the air exchange provided, CO2 simply goes up and tells us that it's time to open the windows, for example, or to turn on mechanical ventilation systems, for example, and for how long. Moreover, once the air exchange has been granted, the algorithm tells us if this kind of interventions have been successful in reducing CO2, and consequently, the risk of COVID-19 transmission in case of infected individuals. Next slide, please. As you see, we are studying the school environment. This is particularly important for the security of our children. Next slide, but it can be, of course, translated into any indoor environment. We have provided some recommendation with the UNESCO Chair on Health Education and Sustainable Development. and address this item. One of the last slide, please. So this, the very last one, and describe CIMA efforts towards a healthy, sustainable society. We have recently published an editorial on the Lancet Regional Health Europe, fostering and proposing European Green Deal as social vaccine, just to connect to the presentation of Dr. Veronica Manfredi. We need a social vaccine to overcome COVID-19 health and economic crisis, which can be based and should be based on energetic transition, on green mobility, on green finance, so that not include only health measures, because we have a lot of critical questions, and we need to address the item of a medical reading of environmental monitoring data, which means that we need to foster controls and to take in account health consideration when we look at the environmental data. And you know that the energetic question is crucial for air pollution and will be need to be much more addressed in next future. Thanks a lot for your attention, and thanks to the panel and to the speakers' chairs. Thanks.
Thank you. Thank you very much, dear Prisco, for your interesting presentation, and also highlights a bit of the latest research you've been conducting on the links with COVID, and also for your also overview over the what issues should be looked at next. Of course, we're looking forward to continuing our cooperation in this field with you and with all the other entities interested to bring knowledge and expertise to our debates. I'm very pleased to announce that this completes the first session, the first part of the experts presentation. So now we can move to the debate. And I would like, therefore, to thank all the guest speakers really for sharing this incredible insight and for setting the scene for the policy debate, which you should have now, based on these presentations and so on. I encourage all participants at this point to actively engage from the floor and registering possibly through the chat function or through us. We will publish the list of speakers so that you can see it also in the chat and plan accordingly. Of course, we are quite on time, so I don't think there's any problem with the timing issues, but in general, we're always trying to keep the remarks to like 3-4 minutes so that we can ensure and listen to more views. Ideally, we will close the list of speakers, and close the interventions by 4:30, so we have a good 50 minutes if there is interest to have such a debate. I have now the first person on the list of speakers is actually a colleague from UNEP, so from the United Nations Environmental Programme, so it's another key actor in this field, Mr. Julien Letellier, who will address us in English. Julien, c'est à toi.
Thank you very much, Marco, honorable delegates, dear participants. Thank you very much for this opportunity to address once again the OSCE Parliamentary Assembly. Under UNEP auspices, the Mediterranean Action Plan has been created 40 years ago as the UN treaty, which gathers a coalition of 21 Mediterranean countries, most of them being represented at the OSCE Parliamentary Assembly, and the European Union as contracting parties to the Barcelona Convention and its protocol to fulfill the vision of a healthy Mediterranean sea and coast that underpins sustainable development in the region. Through our recent promising dialogue with OSCE-PA, we want to foster our cooperation toward pro-sustainability national policy and a green renaissance in our region. As it has been repeated by eminent experts today, the unprecedented COVID-19 pandemic reminds us of the systemic nature of many interconnected long-term development issues and the lack of preparation of countries in the face of the transformation underway. Two recent regional assessment reports sponsored by UNEP-MAP bring new evidence of the healthy toll that the global triple crisis of climate change, biodiversity loss, and pollution is taking on Mediterranean ecosystem and societies. The region is not on track to achieve the Sustainable Development Goals by 2030, and unless urgent and resolute action is taken to halt biodiversity loss, growing impact of climate change, and pressure on ecosystem, environmental degradation could have serious consequences for human health and livelihood. Published by UNEP in October 2020, the report on the state of the environment and development in the Mediterranean, the OSCE, includes a specific chapter on environmental degradation as a risk for human health. Let me quote a few figures and trends. 500,000, so 500,000 deaths per year are attributable to modifiable environmental factors in our region. Air pollution remains the main environmental health burden. Climate change increases risk to human health, for instance, heat waves, extreme events, and natural hazards. Chemical products are increasingly present in the environment, such as pesticides and fertilizer, pharmaceutical and cosmetic products, additives for plastics. And the exposure to waste streams can impact human health with cancer, birth defects, etc. Dear participants, the current pandemic of zoonotic origin provides a wake-up call in favor of the One Health approach towards smart policies and action to bolster the region's resilience to future shocks. In December 2021, in Antalya, Turkey, UNEP will submit a raft of new anti-pollution, pro-sustainability regional plan and decision for adoption by COP22 to the Barcelona Convention. COP22 will serve as a regional forum to take stock of this year's major conferences, including Climate and Biodiversity COPs, the IUCN World Conservation Congress, and the high-level political forum in the context of the decade of action for the SDGs. Most important regional assembly of parliamentarians are partnering with us, with UNEP. As parliamentarians, your contribution to promoting smart investment today in a sustainable and resilient future tomorrow are vital. We count on you to develop national law and policy measures to support the implementation and enforcement of the Barcelona Convention and its protocol. Thank you.
Thank you very much to UNEP, MAP for this interventions, and we also look forward to cooperating with you in the near future. I have now Ms. Doris Barnett, our chair of the second committee, who would like to take the floor. Doris, the floor is yours.
Yes, thank you. It was very interesting and also enlightening to listen to you all. We know that the clock is actually 5 minutes past 12, not in front of 12. However, do you see any nation around, well, in our sphere, who does the right thing, who we should look at as best practice? And of course, it's always a question of money. For instance, if you have poor people, and no infrastructure like buses, subways, things like that, and they have to come to work, and they have old diesels. And as you show, diesel is very nasty stuff. So it's a question of money. What can we do, to help countries and the population to do better? If the people don't have the money. So this is always the big question mark. To us in Germany, it's easy to go into renewable energy. Well, it's not easy, it's easier. Let me take it this way. For instance, I live in a town called Ludwigshafen. We have the big chemical factory BASF here, and they are going to invest 2 billion euros into building their own wind park at the North Sea for their own demand, so to produce hydrogen. So they can do it, but take us as a rather small country in our region. Take Moldova, for instance, or, you know, the Ukraine even. I don't know whether the Ukraine has the power, the financial power to, you know, to totally switch over to renewable energy in a very short time. In a long time, of course, everyone, all the countries will do it, but we actually need to get it done in a rather short time. Now, probably you have a country in mind that does it very well, and you say, well, see how they did it. Probably you can take them as the way you can do it too. Thank you.
Thank you very much, Doris, for all your comments and questions, which we will put to our speakers in due time. If you allow me now, we'll pass the floor to our next speaker, who's the Vice President of the OSCE Parliamentary Assembly, Ms. Margareta Cederfeld from Sweden. Margareta, the floor is yours.
Thank you very much, Mr. Mark Bonabello, and thank you, Madam Chair Doris Barnett and the Rapporteur, Exona, for a very successful seminar. I think the topic today is really important, and I would also like to say thank you to the speakers, because you have managed to deliver a message that's quite difficult, but it was understandable what you said and your measure. And you made it also in a way that was not panic, because as parliamentarian, I have taken part in several seminars, and what's has struck me at quite a lot of them is the feeling of panic. You need to do this, it's too late, it's very difficult, it will be a disaster. And of course, the situation is serious, it's no doubt about that, but we have to avoid panic. The panic will never help us. It will only be more chaos. And if it gets chaos, it will also be more other problems. I could see in front of me countries going against each other's. We will have an open conflict of that. I could also see a lot of people, and we have seen it also in Sweden. I think here about our climate activist, Miss Greta Thunberg, the very young woman or girl. I think she really pointed out that we as politicians need to do something based on science. But just as Doris Barnett said, it's not only science, it's also when it comes to priority, a question about resources, about how to, what should I say, prioritize. What is the most important issue right now? And as politicians, as a politician, I know very well since long time in politics that there are different groups with different issues. You can't do everything. You can do a small piece here, a small piece there. And that's my question to you. What would you say is the most prioritized issue in your perspective? You are several speakers, so I suppose you have different views on this, and I would really appreciate if you have different views, because it shows also that it's not only one road forward, there might be several roads, and we as politicians, we have to decide, but we can't do it by ourselves. There needs to be something behind it, otherwise we will also get lost. And thanks again for this seminar. Thank you.
Thank you very much, Ms. Cederfeld, for these interventions and all the very wise points you raised and questions for our speakers. I will now give the floor to the rapporteur of the second committee, Ms. Elona Hoca from Albania. Elona, the floor is yours.
Thank you, Marco. Dear Secretary General, dear Doris, Vice President, respected speakers and guests. It was really a pleasure to attend this web dialogue, framing the environment, security, and from public health Nexus. And as it says at the beginning, science-informed policy making. And then today we had really a very powerful information, scientific information that would help also parliamentarians to develop their national policies and help them also for legislative work. What I want also to mention as a key, let's say, elements that I find it very interesting is also the European Green Deal with zero pollution actions, the flagship of integrated initiatives, also very, very interesting. Climate as a risk factor for armed conflict, anew. For me, I never heard before, and I find it very interesting, and maybe we can also develop furthermore this as well. The human health of impact of ecosystem alteration, which we know already and we have information, as well as air pollution, health effect of air pollution, and also CIMA has contributed a lot also to give us a bit more powerful information with regards to the how the air pollution can influence also the diseases and also the severity of COVID-19. But again, we all know that the world is facing several challenges, climate changes as well, and environment degradation. So we need also to have this expertise to drive parliamentarians in proper actions and in the proper way. And maybe also a booklet also developed from the OCPA could also help. That also, as Doris said, for example, so knowing also based on some good experiences from other countries that has done more than other countries. And we can also develop and see what also we can do more. I know that there is a lot of, let's say, space and a lot of possibilities for us to engage more. And to also to be based also in the scientific evidences and to be driven also by these scientific evidences. And I find it quite innovative, this let's say this type of discussion that the second committee is doing. Maybe it's not good to speak good for our work, but I think it had made it a difference, and I would like to congratulate again Marco and all the team of the OCPA, from the Secretary General and from all the team that is working, of course. A big thank you for all the respected speakers of today. Thank you.
Thank you very much, Madam Rapporteur, for your words, for your questions, also for your thanks. I would now, I don't have anyone else now currently in the list of speakers. Is there someone who would like to intervene at this point? Otherwise, we will go back to the speakers to answer some questions, and then maybe that will trigger further questions. I also know some members who are supposed to intervene but are not yet connected. So that could also buy us some time to have also some of the other colleagues join in. If there are no other members who would like to raise a question or a point at this stage, I would then ask our speakers to comment on this first round of questions. And I would start again from Dr. Nera. So we start from the first so that we can, and then go back in order to see what comments. Dr. Nera, the floor is yours.
Thank you. Thank you very much, Marco. The discussion has been absolutely great. And I think we are all in the same position. I mean, nobody, after this terrible crisis that our society has been facing, and is still facing, the last thing they want to hear is, you know, we are now almost finishing with the pandemic, but be prepared because climate change will be worse. So here we are, apocalypse now. So I fully agree with the representative from Sweden. I mean, no way, we need to move from apocalypse now to intelligence and opportunities right now. And in fact, all the solutions we are proposing are absolutely proof, make sense, people will understand it. So the message is how we will be from now on, reduce your vulnerability. The vulnerability of your health, because this is one of the things that will worry you the most, and the vulnerability as a follow-up of that to your economy and your capacity as a society to improve. Think about the fact that 10 years ago, even our rich countries, they were not recycling, or only maybe few, environmentally friendly people, maybe the Swedes, you have always been among the best on that, but the rest of us, we were not recycling as we are doing now. So the big paradigm shift on positive that has been achieved on recycling is already giving some optimism. The next one has to be, you were asking us what is the next, I think is the transition to clean energy. At the moment, and I don't want to be negative, but at the moment, fossil fuels are still killing us and contributing to this horrible air pollution, killing our people, making them more sick, making them, let me be provocative on this, and making us even less intelligent. And this is maybe one of the reasons why we are not taking the right decisions. But so if you ask me what will be the most urgent one, stopping using fossil fuels, stopping using coal, stopping and ensuring a very good, fair, quick, and ambitious transition to the clean sources of energy. Second will be plastic. Again, we can remove plastic from our life. And then again, we have plenty of initiatives. Things are changing very quickly, and that will be very good for our health. The non-regrets investments. I mean, who will disagree with the fact that we need clean water? We need sanitation. We need clean energy for our society. We need sustainable food. Nobody will disagree with that. If we give the citizens the good reasons, the health arguments for that, and using a very simple message that they can understand that we are not talking about saving the planet. No, we are talking about protecting our health. We have the solutions, and that will be good for the economy and for the society. So it's a non-regrets. We have no time to lose, that's true, but without using it on a very negative and paralyzing way. We know very well on public health, when you go out and you tell people there is a cholera outbreak, we are all gonna die. It's not the same as if you go out and say there is a cholera outbreak, let's chlorinate the water, let's that you put some protection on the food, and then and let's make as a society an effort to do this and this and that. So engaging all of us, and I think we need to transform this message at the beginning by Al Gore and others when they were saying this is the inconvenient truth. Let's transform it in very convenient truth, which is if you reduce combustion of fossil fuels, you will clean the air that you will breathe, and you will reduce the asthma, cancer, and diseases that you know very well. And in addition, you will protect the economy. So I think the health argument is the positive one that can change things and can ensure that all of those investments and incentives and that the countries are putting now for the economic recovery after this horrible crisis, they will go in the right direction. So I will say COP26, intelligent one. So this is the year of the intelligence. We need to start using it. And this is the only vaccine we have now to address all of these crises that we have in front of us. Although this vaccine might be more difficult to develop than the one we developed for the COVID and the SARS-CoV-2. This is the common sense, so sometimes it's much more difficult. But it's the only one that will save us from this on a very positive. We have all to win, nothing to lose if we go into this direction. And this is maybe the political message that we need all of you to support us on moving into this recovery after COVID-19. Over. Thank you.
Thank you very, very much, Dr. Nera, for this answering the questions and raising these additional points. I would now like to ask Ms. Manfredi if she would like to contribute, and also there were also some points on the European Union raised.
Many thanks, Mr. Bonabello. Actually, very briefly, because I can only completely agree with what Dr. Nera said, and add maybe that I do not necessarily think that it's always only the rich country that have the magic formula to fight pollution. Let's not forget that nature nowadays also proves to be one of our biggest allies. And if I look at the air quality index right now, you know that we have this in Europe, we have this air quality index, which is available available online. You can check at any time the concrete state of the air in several parts, by the way, not only of European Union, but of several other countries that adhere to the monitoring system managed by the colleagues of the European Environment Agency. You will see that also in some countries that I wouldn't necessarily qualify as the richest one, the air right now is pretty okay. You may argue, well, this is linked also to meteorological conditions. For sure, areas where there is a lot of wind, for example, may strike better. But there is also the good harmony with nature along certain coasts, along certain regions where we have beautiful and biodiversity-rich forests, mountains. Hence, I think there is also the solution of, going more and revert more to this alliance with nature that we have really forgotten. But, allow me to be very, very anecdotal. I have a super tiny garden here in Brussels, and for some time I've decided that just let it grow. You can't imagine how much progress I've seen happening over the last couple of years, actually, and the degree of purification of soil, of air, of water. Let's always put also, this is my second message, all these things in connection. I hear a lot, air pollution, health, true. Today data show, and eminent speakers have shown it to you once again, that air pollution is today clearly the biggest driver of health problems in Europe. But for example, if I look worldwide, water pollution continues to remain a major driver of death and diseases. And in any event, also soil pollution should not be underestimated in Europe. If you will have the time to look into the Zero Pollution Action Plan, you will see that we are considering for the European Union to create eventually a system of better assessment of the quality of our soils, because we have also been contaminating them dramatically. And when you contaminate the soil, sooner or later through the food chain, this comes into our bodies as well. So everything is intertwined. Let's think of solutions that create these synergies economically as well. One of the main drivers behind the Zero Pollution Action Plan is to show that with the same euro, as an entrepreneur, as a manager of a big company, as an architect, or as I would say as an individual citizen, has to choose whether to go on bike or buy a car of a certain type or take the tram, that by doing one choice, you tick multiple boxes at the same time for the same euro. So what becomes then the smartest choice? This is, I think, really our message. Thank you so much.
Thank you very much, Ms. Manfredi. I would now like to ask Dr. Professor Lelyville to contribute to the exchange. Dr. Lelyville, you have the floor.
Yes, thank you. Maybe first to the question, which countries are doing well? It was also mentioned that Scandinavian countries in Europe are doing relatively well. For example, Norway is doing very good. But we should also realize that the wealth of Norway is based on exporting fossil fuels, and also Norway has plenty access to hydropower. So I think each country has to find its own solutions. What I think is really important is that we live up to our commitments. We need binding agreements on the level of the UN, comparable to the Montreal Protocol and its amendments. This is what we really need. The technological tools to improve air quality, to go to renewable energy, the technology is there, basically. Of course, it needs to be improved further, but in particular, it needs to be implemented. What is needed is that countries that make commitments are really being held up to these commitments. We've seen very recently that there was an initiative of President Biden of the United States. I mean, the United States of all countries now should suddenly turn green. Now, what will happen in 4 years? What we need is really long-term commitments, and this I think can only be done through the United Nations. So the COP26, I would agree, is really very important. The policy tools to implement clean energy are also well known. I mean, there are very good tools like carbon pricing, and this can be implemented in a way that taxes do not need to increase. I mean, all of these tools are available and they need to be implemented. For the time being, we're still on a pathway to business as usual. Carbon dioxide still increases very strongly according to business as usual. So what has been said is important, the commitments of the EU, the commitments of the United States, also China. But what I see is that countries like Turkey and China as well, and also especially India, are still investing enormously in coal-fired power plants. So we need to put our, we need to really put into action in what we are promising or what we are talking. And maybe one final remark on there was interest in this thing, migration and conflict. From our work and others, we know that climate change is particularly rapid in the Middle East and North Africa. And the temperatures there are increasing more rapidly in the summer than in the winter. And you can imagine that it is already quite hot in the summer in many of these countries. And I'm absolutely convinced that if we are not successful to come to really strong climate change mitigation, then these countries will have heat extremes that are totally unprecedented. And there's no question in my mind that this will contribute to migration and even to conflict. And this comes on top of the migration pressure that we already have. So I think this, of course, is a bit of a selfish argument for Europe, but I think these things really touch upon very fundamental also security aspects. So my answer would be, commitments are great, but we need to find the tools to really live up to these commitments. Thank you.
Thank you very much. I see, I know there is a US congressman who would like to speak. I see Doris' hand raising. She would like to intervene. Doris, would you like me first to give also the possibility to the other guest speakers to answer, and then we go back again to you and the others, okay? So Professor Ioannidis, please, if you would also like to add your wisdom to this discussion.
I very much agree with what the previous speaker said. We have a major problem. It is a very complex one. It is not something that can be solved just with a magic touch, with a single measure, with one thing that can be done. We need to act on multiple levels, and we need to commit ourselves to act with long-term plans. It's not a sprint. It's a marathon. It's not something that we should panic about, because that will make things worse. I think it's important to communicate to the general public that we're facing a problem that needs to be handled with great care and with surgical targeted means, but it's not something that we can solve overnight. It's pretty much the same situation as what arose during the COVID-19 pandemic. Many people got the sense that well, it's going to be 3 or 4 weeks of measures and lockdown, and then everything will be fine. And I think that created a very misleading impression, because pandemic lasts typically 2 to 3 years, and this is a crisis that is even bigger and even more long term. So we need to prepare everyone for living with an agenda that will improve our lives, both now and also in the long term, and maintain our planet and our environment and our lives in the best possible shape. I think that clearly there's some high priorities around fossil fuel, for example, but there's interdependence of different types of energy and of different types of threats that we're facing. And there's interdependence also across different countries. So some of the high income countries may be doing pretty well in their environment, but they may be dumping their waste to areas of the planet that are very poor and disadvantaged and already heavily polluted. And we need to have a global outlook in this. It's not possible just to save one or a few countries if we leave the rest of the world being unprotected and being devastated. I think that some sense of extra protection and extra support for the poor and the more disadvantaged should be a priority, because what all these conditions are generating is inequality, and they also fuel themselves on inequality and disadvantage. And this is one world. It's not separate countries. It's unavoidable that all of us will be affected. if the situation gets worse.
Thank you very much, Dr. Ioannidis. I will now give the floor to our last expert speaker, Mr. Prisco Piscitelli from CIMA, and then we'll go back to our MPs.
Oh, Marco and respected members of the OSCE Parliamentary Assembly. We know we move in a favorable environment because European Union, as was stated by Veronica Manfredi, has approved the Zero Pollution Plan. And this Zero Pollution Plan include some statements that are very specific. One of the statements is that we need to revise the limits of allowed for fine dust in our cities, in our countries, to the WHO recommended levels of the air pollution air quality guidelines of 2005. There are some guidelines issued by WHO in 2005, so it is more than 15 years ago. And we know from Dr. Marianera that these guidelines are going to be revised in July, and maybe we do not expect that they will be revised in increasing some limits. Maybe we expect that, for example, NO2 levels will be reduced, for example. So how to get to these, how to accomplish these results? If the legislative environment is favorable, then, as one of the previous speakers said, we need to turn these into specific actions. How to accomplish these results? Since we know that now we have problems in complaining, in remaining in the limits of the current legislative European levels, at least for the European Union, that are the double of WHO limits. So we have still problems in remaining compliant with the current legal levels of fine dust that are the double of WHO allowed levels. So we really need to take action. I am speaking to the parliamentary members of this prestigious assembly. I was listening to Professor Andy Haynes in just 5 years ago during a conference. It was the first time I was listening to him. And Sir Andy Haynes is one of the major persons in the Lancet Commission for Pollution and Health, was telling in public during the conference that we are not really aware of how bad is air pollution for our health. So he also gave a suggestion, and I just tell to you what he suggested. He suggested to think about a kind of a carbon tax which try to stop the economic gap, which still foster the production of many goods, for example, steel, in other countries of the world where the environmental legislation is not so strictly. So we need to imagine some economic barriers. We need to imagine, to plan an economic environment which is favorable to reach these zero pollution objectives. Otherwise, we will not reach these goals. And I finish this my second intervention speaking about the need that we have to foster immediately alternative energetic sources. We need to invest in green hydrogen as fuel for our trains, for example. We need to stop introducing in our systems, electric systems, energy produced by fossil fuels, because now we produce a lot of energy from renewable sources that cannot be introduced in our electric networks because they are already occupied by fossil fuels, electricity. So we need to do something which is really practical to make this century an environmental friendly century.
Thank you very much, Prisco, for all these very valuable comments and also proposals and suggestions. I will now, and thank you to all the expert guests for taking this exchange very seriously and coming up with a lot of interesting proposals. I will now, I'm very pleased to give the floor to Mr. John Curtis from the United States of America. Mr. Curtis, Congressman Curtis, the floor is yours.
Thank you very much, and good morning. At least it's morning here in Provo, Utah. If you have not been to Provo, Utah, let me just entice all of you. We have some of the most beautiful outdoor adventure and recreational opportunities and beautiful landscape, Native American antiquities in the world here in my district. I serve in the United States House of Representatives in the United States Congress. I've served there for the last 3.5 years. I think it's important that you all know that I identify myself as a very conservative lawmaker. And the reason that's important is I think too often, particularly here in the United States, the US conservative voice has been missing from this conversation. And I think that's unfortunate. Now, also, let me say before I jump in that when I talk about climate, I tend to offend all sides. I have an ability to poke and prod in uncomfortable places to both my conservatives and those who identify perhaps as a little bit more liberal. So this morning, it's not my intent to challenge anybody other than to place some ideas out there for consideration and for thought that I think are helpful and productive in this debate. Now, because as a stereotype, US conservatives have been silent on the climate, I think it's led to an unproductive environment here on the United States climate discussion for several reasons. One is that the agenda oftentimes is painted as extremist or unreasonable. A lot of times we as conservatives challenge our liberal partners of making policies that just feel good but actually don't change the environment. And I'll just bring up one as an example, the Keystone Pipeline. Canceling the Keystone Pipeline, I think all experts agree, will actually increase carbon emissions because we haven't reduced demand. And instead of efficiently delivering that oil, we'll be trucking it in, or oil coming from far more polluting sources. Another problem with conservatives not being at the table is that we're frequently painted or branded as not caring about this earth and caring about the environment. And I'd just like to speak loudly that of course is not true, and acknowledge that as conservatives, we can do a much better job of stepping up and participating in this debate. Like all of you, I care deeply about this world that we live in. As I mentioned, I live in a beautiful part of this world. I have grandkids too, and I want to leave this world better for them than I found it myself. There's also a narrative out there that the United States is somehow not making advancements or is not doing our part on the climate. And I'd like to push back on that. And I don't feel like that's actually a fair assessment. Let me remind everybody that during the last decade, the US has led the world in greenhouse gas emission reductions by dramatic levels. Last fall, this went escaped by most people, but we, on a bipartisan basis, we passed legislation that invested billions and billions of dollars into R&D research, into clean technology, and we reduced our hydrofluorocarbons by 85%. Certainly noteworthy, but I think also went without attention. The United States is leading in advancements in carbon capture and direct air capture. And what's really interesting to me is even without regulation from the United States government, US businesses have really led and made massive commitments to, in many cases, to reduce their carbon by 50% by 2030 and 100% by 2050. Now, the last point that I would make about this problem with conservatives being silent on this issue is the way that we pass legislation and we legislate here in the United States, unless an issue is bipartisan it just will not make progress. And there's many examples of that. And so it's very important that both conservatives and progressives and liberals and moderates of all stripes, that we find agreement on how we can move forward. Otherwise, we just do a lot of saber rattling, and we don't really make much improvements. Now, I'm really pleased. I think in order to combat this problem, we have launched recently here in the United States, we call it the Conservative Climate Caucus. The intent is to give our voice to this dialogue, and we think it's a productive and a helpful voice in this dialogue. And we feel like that doing so, we can bring forth ideas of our own and challenge other ideas and find the best ideas and let them come forward. Now, I'd like to mention several key concepts that I think are very, very important in this debate, and sometimes are overlooked. And one of them is the global outlook. I heard one of our speakers just recently mention the global outlook, but perhaps from a different perspective. And that is that if, let's just take the United States, is 100% successful in reducing our carbon emissions to zero. Let's suppose that we could wave a wand and get us to zero in the next 5 or 10 years. The reality of it is that would only reduce worldwide greenhouse gas emissions by about 10%. And we would fail in our efforts to stave off this climate change. And unless we can engage all partners around the world, particularly our friends in China, Russia, and India, and other very large carbon emitting countries, we're fooling ourselves if we think efforts at home are really going to make an overall difference. So not to diminish the efforts that we're all making at home, but unless we engage everybody in this effort, we can't be successful. The second point that I think is problematic in this debate is what I call the culture of shaming. And what I mean by this is, unfortunately, so often the climate debate is a negative debate where we wag our fingers and point at people. And my experience is that people who are starting to enter this world of caring more and doing more, the moment they're shamed, they are repelled and they leave and they start fighting us. And I think it's important that we start acknowledging accomplishments we have made. Too often in this arena, we simply talk about all the work that's ahead of us, and we rarely talk about the good work that's actually been accomplished. And I think that's a very important thing. The next point I'd like to make is that I believe it's important that we take nothing off the table in our efforts to reduce worldwide greenhouse gas emissions. You might all smile at this, but one of the counties that I represent is actually called Carbon County. Well, what do you suppose they do in Carbon County? They have extracted coal for many, many, many decades. And they push back and they fight this narrative that coal is bad. And I think, let me challenge all of you for just a minute with this concept that coal itself is not, carbon itself is not bad. Carbon in the air is bad. And if we're able to use fossil fuels without putting carbon in the air, we should be able to have that discussion. And too often the dialogue here in the United States is that all fossil fuels are bad and they must be stopped immediately. And the reality of it is, using natural gas, we've been able to dramatically lower our greenhouse gas emissions. And if we used natural gas in places of the world, China and others, where coal is dominant, we could dramatically reduce carbon emissions and greenhouse gas emissions. And so my challenge is to not automatically rule out fossil fuels, but agree to the goal that carbon and greenhouse gas emissions in the air is what we're fighting. I think, and this is where I know that we will disagree with some of our friends across the continents and other places, is I don't think we should take nuclear off the table. An interesting statistic is that while the United States is trying to dramatically lower our carbon emissions, during that same period of time, we'll go from 20% of our energy being produced by nuclear to 10%. Well, what will replace that? We simply don't have the infrastructure to replace that with anything but other fossil fuels. And so I would like to challenge us all to talk about nuclear in a different aspect, and that is, what do we need to change about the way that we currently see nuclear to make it more acceptable to be used as an option. And my final point is I've heard, as I've listened to you today, talk about the devastating consequences of climate change, and I totally agree that those are out in front of us. But reality is that the climate will continue to change. Even if we were wildly successful in reducing our carbon emissions, we're on a trajectory for this planet to warm. And we need to start talking about the realities of that, and that even if that we're successful, we will still have rising sea levels. We will still have extreme heat in certain places, and we need to start preparing for that today. And with that, I will yield my time and thank all of you for your commitments, and express my own personal commitment to join you in doing what we can to fight this worldwide problem. Thank you very much.
Thank you. Thank you very much, Representative Curtis, for this very substantial intervention with lots of ideas. I'm sure that our guest speakers will be challenged and triggered by your comments, and they might come back to you, as I hope. I would like now to give the floor still to Ms. Doris Barnett and Ms. Toril Einstein for some final points, and then we'll go back to our speakers quickly. Doris, the floor is yours.
Thank you. And thank you, Mr. Curtis, for your remarks. Very interesting. We have the very same debates here in Germany, too. Of course, they say climate always changes, but in 10,000 years, not in 50. We can make it that quick. So, and you are right. We can, well, what is it? Carbon dioxide, for instance, is bad if it's in the air. But therefore, I ask our scientists, isn't there any way we can use this carbon dioxide getting out of the air and sucking it out and use it as a resource? I know that there are a couple of German inventors that do that. So we have to be a little bit more creative with everything, because everything has two sides, a good side and a bad side. For instance, hydrogen energy, to produce it, you need a lot of energy to do so. And electrical cars are good, but the footprint of an electric car is not that good because of all the resources you need to produce the batteries. So we have to figure out a clever way to use the batteries, like we use the little battery cells in a lot of things we use every day. So we can just change batteries in the car instead of, have 20, 50 sorts of batteries and things like that. And what can farmers do, for instance, to help to save the world? Can they produce enough food for all of us with no fertilizer, with no herbicide, and things like that? These are also belong to the whole circle of questions that is around this topic. Nuclear power, you said so, Mr. Curtis, you are right. Because the problem of the nuclear waste is a big one, and we haven't found a solution yet. If we have the good solution, then it's another thing. I think we play here four-dimensional chess, and nobody really knows the rules yet, because we have to act, as our speaker said, at once, at so many points at the same time. We have to act there. It makes it so critical and so hard to do, because not all play along. For instance, in the US, we have the SUV culture that use a lot of fossil energy and gasoline. So can we change that all to hydrogen energy or electrical energy with hydrogen module, things like that? And in what time can we do so to help? But it's good. And I would like to ask the Mrs. From the EU, Mrs. Manfredi, if the US reduces 10%, if Germany can reduce 2%, how much percent in all can reduce the EU? And of course, I know that also China is going that way. So, what is actually our expectation within the next? We always want to go to zero by 2050. What are your expectations that we can reach by 2050 if we all really do our homework? Thank you.
Thank you very much, Ms. Burnett. And I will now give the floor to Ms. Toril Eidsham, our Special Representative on Arctic issues, also focused particularly on the issues of climate change. Dear Toril, thank you for joining us, and you have the floor.
Thank you, and thank you for hosting this and bringing this topic to the agenda. I'm really proud that we're acknowledging that environmental and also climate changes have a security aspect. And as Mr. John Curtis reminded us all about the good work ongoing, it's also important to keep that in mind, because I believe it's really important that we need to keep this in mind. We need to keep our future hope, and we need to be encouraged in our efforts to be able to succeed. And as a special representative, I also am very proud that the OSCE has chosen to bring the changes of the Arctic into attention of such a wide organization. Because right now, I strongly believe that it is paramount that we provide understanding and that we all are pulling in the same direction to reduce the negative outcome, both from environmental changes that we see, and also the loss of biodiversity and being able to fight the global climate changes. So we need to build better synergies between the climate changes and the environmental pollution. I strongly believe that that is important. So if you could elaborate a little bit more about the connection on how pollution directly impacts the climate change, that would be very nice. Thank you.
Thank you very much, Ms. Eidsham, dear Toril. Unless there's anyone else from from the floor who would like to say something, I would then revert again to our guest keynote speakers for some final comments and reaction to what we said now, and also for if they have any final recommendation for our consideration. And I would go in reverse order this time, just for a couple of minutes each, please. I would ask Mr. Prisco Piscitelli from CIMA to take the floor. Prisco, there you go.
Just a final statement. As a researcher, I believe that technological innovation produced by research can make the difference. But it needs to find the way, and sometimes the funds, to pass from prototypes to daily life products. And this is true for whatever, energy, transportation, waste, end-use recycling, and also for air purification against COVID-19.
Thank you very much, Mr. Piscitelli. That was rather telegraphic. Thank you. I would now invite Mr. Professor Ioannidis to kindly share with us some final thoughts before we move to the concluding part.
I think that there's a general consensus that there are solutions to the problems that we're facing, and some of them are more effective than others. There's also the understanding that these solutions, they need to have support from the global community. And of course, having the path of least resistance is likely to be most successful. I fully agree that it doesn't make sense to try to intimidate either countries or specific political formations and try to create victims and victimizers. I think it's a global priority that we're facing, and something that we all care about or should care about. Some innovative solutions may help us to expand our armamentarium in terms of how we can respond to the crisis. So research is important, and it could come up with some solutions that are easier or more implementable or more acceptable or more widely distributed. But I think it's unfair to say that we should just wait for these new solutions that will make everyone 100% happy. Again, we don't need to panic, but it is something that we need to act now.
Thank you very much, Professor Ioannidis, for your contributions. Professor Lelyveld, you have the floor. Thank you very much.
Yeah, thank you very much. Maybe I can briefly respond to some remarks. First of all, I very much appreciate Congressman Curtis's remarks that conservatives and everybody needs to work together on this, because we ultimately have the same goal. I mean, this is absolutely correct, and we have to find practical solutions, which I also completely agree with. Of course, it needs to be said that the United States has been successful in reducing its CO2 emissions to a large degree from switching from coal to gas, to natural gas, which is now being produced in large amount by fracking. If this is ultimately a solution is the question, but at least it is helping. So any solution is welcome. Then the question on carbon capture and sequestration. Carbon capture from the air is technically not really feasible yet. There are companies offering this, but it is not really working. Carbon capture can be done where the concentration of carbon dioxide is high, which means in the exhausts of engines and turbines. But then again, this will come on top of the price of the possibly still cheaper fossil fuels. And this is, I mean, I'm not an expert on this, but it will definitely make these fossil fuels more expensive. Now, maybe a few final remarks that I think clean air is really fundamental to human life and ecosystems, maybe even a human right. And of all environmental factors that lead to disease and shorten life expectancy, air pollution is the predominant one. And there's so much clear evidence of many gains from reducing air pollution. And we probably at least should communicate more clearly that there are major public health and economic benefits from reducing air pollution, that the emissions can actually be cost effectively controlled. And there are major public health and climate co-benefits from reducing both greenhouse gas and air pollution emissions, especially by fossil fuel use. Thank you.
Thank you very much, Professor Lelyveld, for your insights and final remarks and recommendations. I will now give the floor to Dottoressa Manfredi for your final comments, words, and answers.
Thank you very much. I also belong to the camp of those who are extremely happy to have everyone on board, conservative, progressive, all minds, all hands are needed on deck, as I like to repeat all the time. Yet, maybe also to stress that it's important for me to say we cannot hide behind the argument of saying, unless everyone does something, then we cannot achieve progress. I think that precisely because we know that we need everyone to move, we have each one to move and move now. And therefore, bear with the fact that maybe certain parties will move a little bit later. We still have to move now. And this leads me to the question that is raised by Mrs. Barnett. How much can we reduce, if Germany does an effort, and how much does in the meantime do the US? Well, what I can tell you is that our leaders have just reached provisional agreement, as you may know, on the climate law for Europe. So we are working very hard inside European Commission as we speak to make the European Union member states fit for the 55% of reduction to be reached by 2030. This is the target we are giving to ourselves as European Union, and each of the countries will have targets which are I would say, in proportion also of their concrete abilities to do, but always with this logic of having an holistic approach, which means Germany may well reach certain targets, not only by acting on its industrial policy, on trying to progressively get rid of the rather strong dependency still from fossil fuels, but also by investing very heavily in nature restoration, in biodiversity. And this leads me also to the question raised by the last participant that was saying, what is the link ultimately between climate change and pollution? What I can tell you is that there is a type of pollution we have not been speaking so much, the pollution that comes from our chemical industries, you know, really the toxic ingredients that then contaminate our rivers, contaminate, more importantly, our seas. I hear in you really a paladin of the protection of our beautiful Arctic. I heard a very passionate plea for protecting the Mediterranean Sea. The seas, the oceans, they are enormous and completely still largely unexplored carbon capture and storer, naturally so, if they are in good health. So preventing all sorts of pollution, even those that are not necessarily only linked to production of air pollution, is super important because we boost the power of nature to help us in this fight. And at the same time, indeed, it's true that we have the same sources essentially for greenhouse gases and air pollutants. If you look at industrial production, they at the same time produce these greenhouse gases and the NOx, the mercury emissions, etc., that then contaminate the entire life cycle. So this is why it makes so much sense to act in synergy all the time.
Extremely eloquent and inspirational. Thank you very much, Ms. Manfredi. And now we'll give the floor to Dr. Nera for her concluding words. You're not unmuted. Yes.
Sorry. I was saying that very little to add because they have been fantastic, the conclusions made by others. For me, cooperation is the war. I mean, the pandemic showed us that we need to cooperate, but not because of the pandemic, but because we are extremely vulnerable, all of us, and together we are definitely stronger. Second, research can provide plenty of arguments and technologies, and I'm sure that a country like the United States will give us very good leading roles as well on developing the technologies that are needed and contributing enormously that they can, of what they can do. Mr. Curtis, I don't speak political language in the sense that conservative or liberal or others, because I speak health. And health is an international and global language that I'm sure that we all speak. And I can tell you from a health perspective that definitely we need clean air to breathe. We need water that is clean. And at the moment, we don't have it. We have a contaminated environment that is not very good. I grew up in Asturias, in the north of Spain, a mining area. So my first practice as a student of the first year of medicine was looking at the sputum of the silicosis patients because they were mining and extracting coal. And then the number of asthmatic cases in the region where I'm coming from, and nobody was protesting because they say, oh, it's good for the economy. Today, the economy in Asturias is much better than at that time. I don't need to tell you how many years ago, because I don't need to disclose certain information about my age. But today, the economy is much better. The hospitals are receiving less patients with asthma cases, and we don't have any more silicosis cases related to destruction of coal. So for me, there is an argument that will reunite all of us, which is the health work, I mean, the health language that we all speak. And for sure, for health, we need a clean air, a clean oceans without tons of plastics and without those chemicals coming from different sources and the mercury and all of that. So if you can make sure that you will clean the air through the technology and doing whatever is needed, please make sure that the air we breathe will be clean and the water clean and the food not contaminated, and then we are all in fantastic agreement. We need to move. As I think is the word here as well is ambition, the level of ambition that we need to protect people's health and vulnerability facing at the moment, and the speed at which we are doing it. And I know that the United States will give us very good contributions, and they are already doing it, but we need more, and we need more. We need more from China. But I think on China, because of business, I'm confident that they will move very quickly now that they realize that this is affecting very much their economy. And again, I'm sure that health will create this environment where conservative or Republicans or Democrats or left in Europe or not or right, they will find a common field where we can move as a society in a better way. Thank you.
Thank you very, very much, Dr. Nera, also for your final comments, and also for stressing all the speakers, in fact, the importance of cooperation, which is the essence of the organization we stand for here. Cooperative security is the recipe of the OSCE, so I hope that this can be applicable also in this context, which requires it very much. I don't intend to summarize anything as it was far too rich, and we'll have our concluding remarks from our rapporteur very soon. Just, there were a lot of interesting points raised, a lot of interesting concepts, a lot of interesting keywords. We can mention a few, but there are simply too many: health, pollution, climate, development, migration, also the connections with very important topics, innovation, technology, synergy, cooperation, action, ambition, energy, of course. So the issues are many, and their interconnections are, I think, huge in this field. It's clearly an interdisciplinary field that requires a lot of expertise and commitment from all sides. So having said this, I would really like to thank all our keynote speakers for their excellent contributions, for their time to stay with us throughout the event. Again, Professor Ioannidis, thank you for waking up so early from California to be with us. And I would like now to move to the last part of our session. And it is my pleasure to give the floor to the rapporteur of our second committee, Ms. Elona Hoxha, for concluding remarks. Dear Elona, the floor is yours.
Thank you, Marco. Dear guests, dear colleagues, thank you very much for engaging in very interesting debate today. I think that today we have vividly exposed the profound relationship between our environment, our security, and our health. It was clear from our discussion that the reversing environmental degradation in all its forms, including climate change and pollution, and mitigating its detrimental impact on our health, is a shared security priority of all OSCE participating states. It is also inspiring to hear how we should leverage on this momentum and shift towards more environmentally and socially sound policies to promote sustainable development across the OSCE region. Indeed, the need for well-informed and coherent strategies is greater than ever before. We should seize the opportunity to address our growing developments needs more responsibly. What we need is a more balanced and forward-looking development strategy, a strategy that clearly responds to the environment concerns of current and future generations of citizens. In a nutshell, we must aim for a development model where economic, social, environmental, and public health factors are duly considered and balanced. Against this backdrop, I believe that we should support the low carbon energy transition and endorse projects that prioritize investment in green technologies and clean transport. The transition from fossil fuel to green energy is generally recognized as a single most relevant step towards cleaner air and the mitigation of climate change. Hence, we should harness its full potential. For instance, e-mobility is an essential tool to achieve climate neutrality, promote cleaner mobility, and protect public health. We should promote green finance and more responsible economy that considers the environmental impact and enhances environmental sustainability. It is critical to increase the level of financial flows from the public, private, and for non-profit sectors to sustainable development priorities. Notably, well-regulated green finance channels funds towards these economic initiatives that better manage environmental and social risk. By doing so, we can ensure opportunities and bring both a decent rate of return and environmental benefit while delivering greater accountability. In addition, we should promote standardized tools to measure the final production values of companies, including their environmental impact. Harness the opportunity offered by the digital revolution and technological innovations to support the green transition and ensure justice and inclusiveness. We should recognize and foster the critical contribution of digitalization, new technology, and science in solving environmental problems. Science and technology should be treated as potential allies to achieve a more balanced, healthy, and fair society. Finally, we should strive to keep everyone on board, as will only be as strong as the weakest link of the chain. The environment is only one, and everyone needs it to survive and thrive. Dear colleagues, our role as policymakers is more important than ever. Let us not forget that parliamentarians not only hold the power of legislation, but also of oversight and fair allocation of national resources. It is up to us to make sure that our national laws, policies, and budgets are promoting growth, not at the expense of the environment and public health, but rather in support of the environment and public health. As a rapporteur of the General Committee on Economic Affairs, Science, Technology, and Environment, I'll duly reflect these considerations in my report to 2021 remote annual session. Moreover, I will encourage the second committee to keep up this critical line of work, continue building knowledge and policy convergence around these fundamental issues, and further strengthen our policy science interface. For instance, looking more carefully at the complex energy transition chapter, which would offer us a good opportunity to achieve all this while adding a distinct parliamentary contribution. To conclude, there is plenty of difficult work awaiting us. We must be up to the task. Thank you very much and good evening to all.
Thank you very much, dear Ilona, for this concluding words and the genuine commitment you have put into the work, exactly as our chair and as our deputy chair. I hope that indeed today's exchange will help you and give you some ideas for the report. For your report in view of the annual session. So before closing, unless there's anything else that anyone wants to add anything else, otherwise I will just move to the closing. I would like to thank again all our experts for their excellent contributions and all our participants for their constructive engagement. I would also like to thank the team of interpreters for their professional support, as well as the teams in Vienna and Copenhagen, our PA teams, for supporting the organization of this event. I hope you found the policy exchange, policy dialogue thought-provoking and somehow inspiring in this complex domain. I now declare the meeting closed, and I wish you all a very good evening from Vienna, Austria. Thank you very much, and bye-bye to all. Thank you again for all the speakers and all your time.
Thank you. Bye.
Bye-bye. Thank you.
Bye-bye.